So for me, this is why a clinic is state of the art, is because of the people behind it. So good nurses, passionate nurses, a good system from a healthcare perspective, and then the facility is just there to facilitate that. That's why the word facility. So for me is, if you have good people, and we have good people that have built this clinic, that's when you can get a state-of-the-art facility, and that's what we're seeing here. And it's a culmination of years and years of investing in primary healthcare facilities in this community to ensure that we get to this point of where we can help the amount of people that we're helping through this clinic. Primary healthcare, and particularly private, in inverted commas, primary healthcare that can be done through NGOs or through social enterprises, for me, is not only helping millions of people through access to quality healthcare facilities, but in the process you hire community health workers, in the process you hire nurses, in the process you hire auxiliary social workers, in the process you connect people from a nurse to a doctor. That needs to be facilitated by data capturers, by telemedicine specialists. So in each clinic that we build, and this is a larger one, so we employ more people, but in each clinic that we build we hire about 5 to 10 people. In this clinic that's 15 to 20. So for me, youth unemployment, youth needs to understand that this is a valid career pathway, and that it's a career pathway that they can implement in their own community with a social good towards it. So for me, that's part of why this is indeed also addressing youth unemployment.
So healthcare is a backbone and foundation. Without a healthy community, nothing can be done. So we believe that's the reason why healthcare is really important. We are involved in ECD training, where we train teachers and principals. The concept around there is to really ensure that the kids are school ready, they've got a curriculum in the township, they are able to have a great nutrition and understanding of how to run an ECD. We've got skills development. In our skills development, we train IT and fashion and design. These are in order for the guys to be able to be employable. I think I touched on the fact that the output of it is going to be under Rhiza Enterprise, the IT business and fashion. Those are exciting new things that we do as an organization. We've got entrepreneurship. Entrepreneurship is about creating entrepreneurs. We've got different programs. We have developed and created a curriculum of which we want to train entrepreneurs for them to be able to get access they get access through us, network, access through computers, internet, telephone, printing and services when they are incubated within our programs. Lastly, it's entrepreneurship. Agri, it's about food security. The problem is there, the problem is real. So we're here to assist people from the community for them to be agripreneurs. They start off by being trained on how to grow crops, and then we convert it and bring in the curriculum from our entrepreneurship program, where we train them on how to be entrepreneurs. We provide them access to the same services that are provided to entrepreneurs, but further services that we provide them is access to a portion of land of which they can be able to develop and grow their crop and sell to the community. The partnership with Africa Tukun is in various programs. We mostly work within the same areas, and due to that, instead of competing, let us partner, and where they've got strengths, and where we might have our weaknesses, and where they have their weaknesses, we are their strength.
We started the service in Diepsloot Extension 6, where we were seeing only immunization, and then after 1 year we increased our services to see family planning, curative services. We wanted to attract males because we could see they are lacking, because we said we are a mother and child clinic. So they thought we don't see males. So our services, we increased them. In 2017, we started with antenatal, which is the biggest service now. Remember, when you do antenatal clinic, you are going to do HIV/AIDS, because each and every mother that come for antenatal, we have to test. We know that there is a program, prevention from mother to child infection. So we are doing that service, which is very, very big. And with the help of Philips, who provide us with high-tech equipment, we are doing ultrasounds because we want to detect the abnormalities at an early age, so that you prepare the mother and you save a child if we can. So our antenatal clinic is very, very big, and also now, because of the testing of HIV/AIDS, we are providing ARVs for both mothers, children, and adults. We are providing ARVs. And why we are able to provide all these services is because the Department of Health is providing us with medication. But we all know that towards the end of financial year, there is a shortage of this. We buy our own. Where do we get the money from? The sponsors, Shukululu, Philips, and other sponsors? Well, I'm not involved in the donations, but they also pay a little fee for their services, so that we are able to buy dry dispensary medication if it's short, because I hate the word "aiyo," we don't have. You come from home vulnerable, sick, you expect to have medication.
For more stories like these, go to www.social-tv.co.za, subscribe to us on YouTube, and follow us on our social mediums.